Let's go.
Welcome to The Integrative Edge, your go-to podcast for fresh perspectives on holistic health and functional movement. Join us as we explore innovative ways to optimize your health naturally and sustainably.
I'm Kelly Demers, founder of the Integrative Wellness Coalition and the owner of True North Performance.
I'm Lindsay Seefeld, doctor of physical therapy and owner and operator of Uplifted Oncology Rehab.
I'm Dr. Kimberly Klimek, licensed pharmacist and owner of Innate Healing and Performance.
You can find the show on Spotify, Apple Podcast, or wherever you get your podcasts. Subscribe so you never miss an episode.
Welcome to the Integrative Edge, your podcast where we explore innovative ways to optimize your health naturally and sustainably. I am your host, Kelly Demers, and as always, I am joined by my two amazing co-hosts, Dr. Lindsay Seefeld and Dr. Kim Klimek. Ladies, welcome back.
Yes.
Today's episode is called Cracking the Fertility Code, Balancing Hormones and Optimizing Health. Whether you're actively trying to conceive, dealing with hormone balances, or simply looking to support your reproductive health, this conversation is for you. Lindsay, I'm going to kick it off with you first. Do you want to go over some of the basics, Fertility 101?
Yes, definitely. We're going to go through this. So just before we start, oh my gosh, just talking about the whole reproductive system. My oldest just recently learned this in school about the birds and the bees. And let me just say, that was a really fun conversation. We have 4 kids at home and my son thinks we only did it 4 times. So, so it definitely was a very uncomfortable talk.
Funny. Miracle.
Yeah, that's right. Just 4 times. That's how we did it. So, but yeah, I definitely think it's very important to go kind of step by step on how fertility really happens and how, developing a baby happens in our bodies. So, the first step is, we've all heard this, we ovulate during our menstrual cycle. And what happens is when we ovulate, the egg is released and we have little tiny finger-like structures that help move and push that egg and guide it down the fallopian tube. And this, in the fallopian tube is where, when, you have intercourse, ejaculation happens, and this is where the sperm will then meet the egg. We've got tiny millions of sperm that are traveling up there, and then you just need that one to get it done, right? And so when that egg is fertilized, we call that a zygote. And then it takes about 6 days for that zygote to travel down the fallopian tube and eventually end up in the uterus. And, it's really the biggest process is then once, that it meets the uterus, it will then implant. And so this is a very important part because people don't really think about you have to have both of them. Yeah, you can, have fertilization, but if you're not having that implantation in the uterus, a baby won't be formed. So definitely once you have the implantation, you have cells that are distinguished for the baby and cells that are distinguished for the placenta. And then obviously it keeps replicating and then you have a baby. It's very important to think of, it's a 28-day process. That's how our body cycles. And so day 1 is considered, our first day of our period. And then around day 14 is when ovulation occurs. And then it's interesting that, once our egg is released, the egg only lives about 24 hours. But sperm actually lives for, I think, up to 5 days. So it's important to, if you're trying to conceive, it is actually good to probably practice a little intercourse before you actually ovulate to kind of help increase your odds of getting pregnant. Mm-hmm. So that is the 101.
That's great. Thank you. Kim, from a functional medicine lens, what are some of the key hormones that we need to be paying attention to when it comes to fertility and just overall reproductive wellness?
Yeah, this is such a hot topic right now. And I would say I get a lot of clients, even in my practice, for this specific goal, right? They're working on fertility or they've been struggling with infertility or miscarriages. And this episode is just going to be super enlightening for many people who may not have gotten this information from maybe some of their conventional providers, because there's a lot of things that I can see are not really happening to help them get this full picture when they go to the doctor's office. And so we'll break that down. So this is really like the bread and the butter right here, most of the scientific stuff. But so when we're looking at hormonal imbalances that affect fertility, some of the primary things I'll be looking at is thyroid function and how that affects fertility, and then some of your sex steroid hormones and how that impacts ovulation and implantation. So thyroid hormones, they are extremely important because they help regulate ovulation, they help regulate your menstrual cycles, and then the development also of a healthy uterine lining to maintain the pregnancy. So even in our previous episodes for thyroid health, I talked about how people they can experience like subclinical hypothyroidism still, which that can impair their fertility chances. It can increase the risk of miscarriage and also affect a baby's brain development early on in pregnancy. So thyroid hormones, especially like when we talked about T3 and T4, that plays a direct role in the signaling to your hypothalamus and your pituitary gland. So we have these fancy like feedback mechanisms where our body it's like a feedback loop, and your body sends these signals and chemical messengers to your hypothalamus and your pituitary gland to release these hormones. And so the role of thyroid hormone is that it helps regulate the release of gonadotropin. So you may have heard the term like follicle stimulating hormone or luteinizing hormone, and this is basically critical for follicle development and ovulation. So again, if your thyroid function is suboptimal or you're not really getting that full picture even of your thyroid health, right? We talked about how thyroid antibodies can suppress ovulation and those types of things that basically, essentially at the end of the day, it disrupts your signaling, and it could lead to anovulation where you're not ovulating at all, or irregular ovulation. So you're not really ovulating where Lindsay talked about during that kind of like day 10 to 14 window usually. It can affect your menstrual cycles, right? So like if you're hypothyroidism, sometimes it can cause longer cycles or missed periods due to reduced LH and FSH production. Also can affect progesterone levels, which we'll talk a little bit about here. And then if you're more hyperthyroid, again, that can lead to potentially shorter or lighter cycles, all of which affect your ovulation and your ability, that feedback mechanism for fertility. And then the last one I talked about was just how the thyroid hormone really influences estrogen and progesterone levels. So again, the balance of estrogen and progesterone is super important to essentially build up and maintain a healthy endometrial or uterine lining. And without proper thyroid function, usually progesterone levels can be low. So then that can lead to an unstable or a thin lining as well, which can prevent implantation of the egg. So again, it's just this beautiful, perfect scenario that kind of has to happen in the body for all this to happen. And there's other things that we look at too. But progesterone is very, very important because it helps us maintain the uterine lining in pregnancy right at those kind of perfect amounts, right? Not too much estrogen can make the lining too thick. And then if you don't have enough progesterone, I think this is the one area where many people are a little bit more aware of it, but sometimes it's like fighting tooth and nail even to get like a progesterone lab from your provider. And then oftentimes I'll see like the doctors just kind of like, oh yeah, your progesterone levels are fine, even though they may be very symptomatic with irregular cycles, mood imbalances, very tearful, experiencing painful periods, this and that. And then like it just increases the likelihood of infertility and miscarriage, even if you do become pregnant, if you kind of go into that pregnancy with suboptimal progesterone. So progesterone, it basically helps support implantation in early pregnancy, right? It prepares the uterine lining to receive and nourish that fertilized egg, which is essential for preventing early miscarriage and if you do become pregnant as well. It helps us regulate the luteal phase. So after ovulation, progesterone will rise to help us sustain a healthy luteal phase, or basically the second half of our cycle. And then again, you can kind of tell if you're dealing with some progesterone imbalances based on having irregular cycles alone, I would say. And then again, it's a very like calming and anxiolytic hormone. So it can kind of calm the immune system, help reduce inflammation in the body. And it just creates a more favorable environment for conception and embryo development. And then the last one I just wanted to hit on here too is just how estrogen dominance affects fertility. So again, if you're signs and symptoms of more estrogen dominance in the body, right? Just the definition alone, estrogen dominance is essentially you're kind of suppressing even maybe what progesterone your body is making, or if it's not making enough, it's just still going to always overpower that. And that can disrupt ovulation. So it can essentially suppress the LH surge that's needed for ovulation. So that can, again, lead to anovulation, and then it impairs that uterine lining balance that we talked about. So if you have too much estrogen buildup without enough progesterone to stabilize it, the lining can become too thick or unstable, making implantation of the egg more difficult and unable to kind of stick for the pregnancy.
That is a really great foundation. One of the things that I had a couple squirrel moments in there where I was like, it seems like the conversation, and we're gonna dive back into the hormones. And
I was like, we didn't even talk about cortisol yet.
I mean, so I want to talk about cortisol. I want to talk about insulin and all of those things. But before we do that, I want to take a step back, and that is to talk about. It seems like the topic of infertility is it's becoming more mainstream. And is that why do you think that is? Two, has that always been the case and women just haven't talked about it? Or is there something that has changed that's bringing this to be more prevalent in today's society?
Yeah, such a good question. And honestly, I feel like my answer is just like we're living in a much more toxic world than we were years ago. And again, like I just think back to the time, like back in like my grandparents' time, like the women were homemakers. They were able to stay home and able to kind of nurture that home environment, stability, be a little bit less on the go, right? Like everything now that we do is just go in a fast-paced world, and then we're exposed to more toxins. There's more processed foods, chemicals. All of that literally affects your cells in your body, which affects your ovulation. It affects your ovaries. It affects, thyroid hormone production. And that's really, I would say, a lot of the underlying things, right? And I'll dive in a little bit to like some of the like functional like testing that I do with some of the fertility clients. But I think that's where it's coming from at the end of the day. And then a huge portion of it right now seems to be the cortisol steal that happens. And I can explain that. But it just prevents like the balance of cortisol in the body, and then ovulation and estrogen and progesterone levels at the end of the day.
Sure. Anything to add?
Yeah, I completely agree. I think it's just the way we're living, like the high stress, the activity, the unhealthy foods that we're putting in our bodies, like all the processed, the toxins, it's just the excess weight that we're putting on. It's just, I think it's so compounding, and we're changing.
Mm-hmm. Absolutely. Do you want to, Kim, I'm going to throw this back to you. You had talked on a little bit about cortisol, and I think that's so important because I haven't had fertility conversations. However, from those that I have talked to about it, it seems like cortisol is often left out of that fertility conversation, and it really can throw things off. Again, stress is so underestimated as a culprit for so many things. Do you want to dive into the effect of cortisol?
Yeah, I was just thinking too, like a lot of the like fertility clients that come in, like they do just say, like the doctor just says, well, you just need to be less stressed and don't worry about it, and just it'll happen when it happens, kind of thing. And I get their frustrations with that too, because it's like, as far as I'm aware, like you have to be trying even for like a full-blown year before they're even going to consider any type of like fertility strategies. And what are those strategies at the end of the day? Like, so I'm going to talk a little bit about the hypothalamic pituitary like adrenal. We call that the HPA axis, and there's the HPG. So it's hypothalamic pituitary gonadal. Again, it's essentially this feedback loop between the chemical messengers and the signals that your brain sends to like your ovaries and your adrenals and those organs that help with hormone production. But in essence, when these things are going wrong, the conventional strategies are generally to pump you with medications that force your body to do these things, right? Like force your body to send a signal to your ovaries to release egg or, HCG injections, all these kind of things. It's basically trying to force your body to do that. And it may work and it may not work for some people, right? And then again, lots of medications come with different side effects, that kind of stuff. But I feel at the end of the day, like our bodies were meant to do this, and there's so much like root cause approaches that just never get looked at or addressed. And we can physically measure these with some of the functional medicine testing and then strategies to help support the body. And again, it's coming back to same things as all the other like chronic health conditions. We are looking at lifestyle changes, functional nutrition, and root cause strategies. And yeah, we can dive a little bit. Like I'll kind of give you some surface level recommendations for like key nutrients and things you want to think about for like fertility support. But let's definitely hit on the stress component, because that's often what you get told when you go to the doctor's office. Like, it's just stress and go home and don't worry about it. It'll happen when it happens, kind of thing. But adrenal health does influence our reproductive hormones. So again, cortisol is produced by that HPA axis. So it's the hypothalamic pituitary adrenal, which is closely linked to the HPG axis. So the hypothalamic pituitary gonadal that regulates our sex hormones. So when stress is high, I always tell my clients this, like when stress is high, our body is just constantly shooting out cortisol. And it's really in this prioritization of survival mode right now. So your whole other hormone pathway and cascade on the right side here basically gets shut off. And we call that the cortisol steal, because your body is prioritizing making cortisol because it is anti-inflammatory and protective. But if it's constantly turned on, you're basically going to essentially get no production of your hormones. And I just said, in that 28-day cycle that Lindsay described, you have these beautiful flows and the ebbs of your hormones. And if you're not, having that nice ovulation around day 10 to 14, and then the luteinizing hormone spike, and then the second half of the cycle where you need progesterone's peak, all those things are going to have an interplay with fertility factors. But stress can suppress that whole pathway. Because it will downregulate the production of those hormones. And then also the presence of just high cortisol in general has a large effect on the body. So it's going to suppress that gonadotropin releasing hormone pulsing that happens from your pituitary. And again, that affects your LH and your FSH. So those are two primary things needed for ovulation. And then just elevated cortisol in general can increase like oxidative stress and inflammation on your cells. I think about that primarily for like egg production and like the ovaries, because essentially that can create like mitochondrial dysfunction in your ovaries, which that's something that many women don't really like hear or often talk about. If they're like not producing eggs, they don't really think about how certain types like cortisol can affect that. And then also just toxins, like exposure to toxins can affect their egg quality. And then also like egg maturization. But the other thing is chronic high cortisol basically blocks your thyroid hormone receptor sites. And again, at the very beginning of the episode, we kind of talked about how those thyroid hormones are necessary for the signaling process. But I would say in general, cortisol is important because if it's out of balance, the body basically receives the message that it's not safe. It's not a safe time to be trying to conceive. I'm going to prioritize your safety over those other complex processes that need to take place in the body. So it is like when you're working on fertility strategies, it is a time to slow down and think about other things, right? Like I wanted you to hit a little bit on, like we were chatting here about like just how exercise influences your fertility, even if you're working on fertility. Right.
So I do want to pause and talk about that, because we talk about cortisol spiking. That's what exercise does. It is a stressor on your system. So going to the gym to max out, or some of those long endurance sports, they might work against you instead of with you in terms of supporting that hormone balance. So a better option, if you are going down this fertility path, is to slow things down. Things like walking and yoga and more gentle movement. Just maybe peel back a little bit on the intensity. Let your your nervous system regulate and slow down a little bit more, and so that you can rebalance those hormones, it will be more effective in the long run than any high intensity workouts. Lindsay, do you want to add?
I mean, it's just like you think about this, like in general. I mean, that area is so beautiful, right? Your uterus, you're carrying a baby, and you have to be in the optimal state to be able to carry that baby. And so if you're, like you had mentioned and Kim had mentioned, if you're constantly under high stress and, like you're doing intense workouts, your body is saying, we don't have enough to support a baby growth right now. So, our pelvis is so highly vascularized. We have so much lymphatic system down there. And so if things are not moving optimally, I mean, we talked about this during we had a really great gut, we've talked a lot about the gut health and stuff. And, your body will shut the gut system down if you're highly stressed. The same thing happens down there. And so you have to do those things to slow your body down to support the growth of a baby.
Absolutely. So along with that cortisol conversation, it leads to something else that pops into my head. Kim, when you're working with someone who's struggling to conceive or has irregular cycles, what are some of the root causes that you look for that might not come up in a typical OBGYN visit?
Yeah, great question. Well, first and foremost, for me, it's actually just getting a full picture of really what's going on with their thyroid health. Like, again, we talked about that in the previous episode, all about our thyroid health and how the full picture never really gets identified for clients because they're normally just getting like a thyroid stimulating hormone lab run. So again, you need to get a full panel where you're looking at, yes, thyroid stimulating hormone, but like free T3 levels, free T4, checking your antibodies, because literally those antibodies will prevent you from potentially ovulating and things like that. Like I had one client, she had high thyroid antibodies, TPO marker, and then she also had anti-ovarian antibodies, which is a very unique scenario and super special client of mine. She's actually now pregnant. So just a wonderful story, but just told for a long time that she was probably not going to get pregnant, and she had to go to potentially a very expensive like fertility clinic out in California. And I'm sitting here looking, like she came to me, and I definitely think she came and she's just kind of like, I'm going to try this and like see how it goes, but it just doesn't work out. Like in the beginning, she's just like, I think I'm going to go on to like doing the other fertility strategies and IVF and other stuff. And I was like, I got her like lab work and all this stuff, and my eyes just got so big. So I'm like, I see so many areas that we could help your body with that are not being addressed right now. And yes, some of those things she was dealing with, again, irregular thyroid issues. And then just based on some of those symptoms alone, like high thyroid antibodies can essentially be coming from also like autoimmune type conditions and microbiome imbalances. So we worked on gut health for her. And we did like liver cleansing to help her thyroid work better. And she did everything that I had asked her to do. And it was really like within 6 to 8 months of working together, she was pregnant. So I was like, your body can do these things, but the deeper root cause testing is like, yeah, we did like a full hormone panel for her. She basically was non-existent in progesterone. She described her job as a little bit stressful. So of course, right, we probably had some cortisol steal going on. Cortisol patterns were irregular. Progesterone levels were low. Androgen levels were a little bit higher. So those are all things we look at, because like that's more of a primary picture too for like polycystic ovarian syndrome, where they have higher levels of androgen and no progesterone too, which can really be, obviously there's a lot of research in the fact that polycystic ovarian syndrome, a lot of clients will have fertility issues if they have that condition. But again, I feel that it's personally just a label you're getting labeled with, and we can still work on all these things for fertility. But I do look at things like metabolic health and blood sugar regulation too. This client had a very high fasting insulin level. Optimal level is going to be more like 6. Hers was definitely more than like 3 times the normal range. So I'm like, okay, all those little things that are happening right now, we can bring those back into balance, and your body will do these things. But you're looking at just hormone balance, getting a full hormone picture in general, full thyroid testing. And then that's where I just say it's kind of diving into a little bit more toxin exposure and addressing that. And we did that through like gut and microbiome testing for her.
Yeah, I love it because you're painting a really full picture, and that's empowering because it's empowering because there's so much that can be addressed. I think so many times you think there's only one avenue to go down, and so it's refreshing to hear there's actually a ton of things that we can take a look at. And I think we talked about this earlier too. When they come to you, they feel like they've been told so many times that everything looks normal, you're fine, but they're still feeling off. Lindsay, I want to bring you back into this from a movement perspective from your world. Are there specific movement patterns or restrictions that might interfere with pelvic or reproductive health?
Well, I think we talked about this. I mean, it's just watching that we're not doing these high stress impact exercises, but anything to promote that wonderful blood flow and lymphatic health down in our pelvis, because we need that healthy blood supply. We need that healthy lymphatic system to support that baby. So
energy
yoga,
flow.
and energy flow, right? Yes. But lots of stretching, deep breathing, which I know you're awesome at, Kelly. But I think, in just, optimizing, like that lymphatic flow by, working on your gut, making sure things are moving. I think anything to support. I love getting on a ball, like doing ball type exercises to get the blood flow to the pelvis. So I think it's just really I think it's time to slow down. I think when we're having a baby, we need to slow down our body and find ways to move our body and our mind, healthy.
Yep, that is huge. I love that you talked about breath work. I'm a huge proponent of breath work, diaphragmatic movement, because they are often overlooked. And when you do that breath work and when you do that diaphragmatic movement, it is essential for pelvic health. It's and hormone regulation. Deep belly breathing starts to regulate the nervous system, which is then reducing those cortisol spikes, and it supports lymphatic drainage and all of those things that are working together to support the end goal of a healthy reproductive system. Kim, I told you I had a loaded question for you, and we might have to unpack this in a couple different columns, but I'm gonna shoot it out to you all at once, and we can unpack it as we need. Can you share a few food, lifestyle, supplemental strategies that people can start to implement right away to support hormone health?
Yeah, excellent question. And I will provide a little resource or a reference in our show notes for this too, because I get this question all the time. And I'm like, okay, yeah, even looking at your prenatal and stuff like that, you need to have active forms of the minerals and the nutrients, and they have to be in optimal doses. So we'll dive into that in a second. But one thing I did forget to mention too, and this triggered me here, is just it's so important for mineral balance for fertility. So that's the other thing too, is I've used hair tissue mineral analysis, but this actually affects pre-pregnancy, during pregnancy, and post-pregnancy. If your minerals are not really balanced, if you don't have enough magnesium, balance in calcium in the body, zinc levels, that kind of stuff, it can affect not only fertility, but it can affect your the way you feel during pregnancy, and especially postpartum for sure, because you need minerals and electrolytes during this time more than ever, and that can actually affect the way you during pregnancy. If you are more nauseous, that is heavily linked to that, looking at your magnesium levels and your mineral levels in the body, and it will make you have a better pregnancy if you go into it with some of these things looked at and cared for. And obviously we could have a whole separate episode, I feel for just postpartum support and how that's not getting supported very well for women right now. And there are amazing experts out there, and I look forward to supporting clients with that too. And we have strategies for that. But one of the big ones is just insulin resistance and how it can disrupt ovulation. So you just want to be making sure dietary wise, you are focusing on protein, getting enough protein, healthy fats, and fiber to stabilize your blood sugar through this process, and how that affects your hormones for sure. So that's, and then we just talked about the lifestyle things of slowing down, right? Prioritizing breathing, maybe slower, more restorative movements. Nutrition, right? Eating whole foods, anti-inflammatory, The thing here too is that all these like environmental toxins, like endocrine disruptors, you're thinking about plastics, phthalates, pesticides, that all affects your egg quality and sperm quality. Because we didn't even talk about the male's role here, but also like it's not just on the woman's shoulders for everything that they're doing for fertility. Because we could have a whole episode on like the male's role in fertility and how like sperm production and like testosterone levels are declining faster than ever right now in our society. And it's like we have to ask these questions, why? So they are also equally important to be working on their health during this time of fertility support. So let's not neglect that, because it's not all on the woman's shoulder. But definitely some of the key nutrients you would want to look for if you're looking for like a prenatal and fertility support. And again, I can provide a more direct list and optimal dosing for this for the listeners too. But one of the primary things is getting folate, and you want that in the active form because that supports not only DNA synthesis, egg quality, fetal development, definitely particularly neural tube and brain development in the baby. It's essential and crucial for the early stages of pregnancy too. And again, it's more effective than synthetic folic acid. It's also better absorbed because oftentimes people, if you look at like a prenatal that like the conventional medicine gets you, or even if you're getting it from like a regular pharmacy or something, like read the label. You're going to see it says folic acid, which is not the same as a methylated form of folate. So it would like on the prenatals, you're looking for like L5-MTHF, which is like a methylated form of a folate, so that it's better absorbed by your body. And especially for people who have like the gene variant, the MTHFR gene mutation, which that could be a whole episode. But again, a lot of people walking around have that. I have that. So it's just like you got to get active forms of vitamins. Then one I think of one is choline, which is essentially, it's very important for early brain development and placental function. And a lot of women don't get enough choline too. And we get a lot of choline from like eggs. So eat your eggs. But that works.
Expensive.
Yeah, right? Now they're expensive. So it works synergistically with the folate. So that can reduce neural tube defects. And then again, that's basically like non-existent in conventional prenatals. And then, of course, vitamin D3 and K2 that supports, vitamin D supports so many things. It supports hormone regulation, ovarian function, bone development, immune health. And that oftentimes people, they don't even get that lab read, like when they go to the doctor half the time, or you got to ask for it still. And it's like such an important hormone. Deficiencies in vitamin D3 can be linked to irregular cycles, polycystic ovarian syndrome, actually lower IVF success even if you are doing that. But then it also reduces pregnancy complications when you have that correctly balanced. And you want to probably be more around like the 70 to 90 nanograms per deciliter on a consistent basis. And then I always tell people, make sure you take your vitamin D3 with K2 because that ensures proper calcium distribution in the body so that it doesn't build up in the arteries and it also directs your calcium to stay in your bones and then and has supports like teeth. Things like that. Omega-3 fatty acids, gosh, that's a hot topic because oftentimes the blood work that I run, people's HDL levels are super low and then triglycerides are really high, and that just indicates you're not getting enough good, healthy fats and omegas in your diet. And yeah, if you don't eat a lot of things like wild-caught fish, organic ground flaxseed, in Wisconsin, I take an omega every day. I feel like it's kind of just one of those foundational things because we don't get a lot of good wild-caught fish supply here in Wisconsin. We don't live out, on the coast and have a lot of exposure. So it's just something where I feel like I do supplement that for myself, but it helps reduce inflammation throughout the body, balances hormones, improves your egg and sperm quality. And one of the primary things for fertility is it reduces the risk of preterm birth and then supports maternal mood as well. And DHEA in particular supports fetal brain, eye, and nervous system development. So these are just like non-negotiables like that you need to be thinking about. Magnesium regulates your stress hormones, supports healthy blood pressure. I think about this primarily, and again, we talk about magnesium, how it's important for like over 400 enzymatic functions in the body, and a lot of people are deficient. We can't even raise our vitamin D levels if our magnesium is not optimized. But more specifically for fertility, it helps prevent it helps reduce the risk of gestational hypertension and preeclampsia, because one of the things we use for magnesium for in functional medicine is reducing blood pressure. So making sure you have enough of that during fertility. Zinc, essential for hormone production, helps with testosterone production, helps egg and sperm development, helps your immune system. But basically like low levels of zinc that can affect both fertility for males and females. Iodine, that's essential for thyroid function, fetal brain development. I kind of talk to people about inositol as well, because that can help for not only egg production, but also helping reduce blood. It can help with blood sugar balance for the body. And there's 2 different kinds, and obviously it just depends on where your androgen levels are at. And that's why you need make sure you get the whole picture and you're not using the wrong stuff, because different inositols will affect your testosterone levels. And a really cool one that I like to talk to people about is CoQ10. It's basically a powerful antioxidant that supports mitochondrial function. So if you're not like producing enough eggs, it can really help your ovaries. And that's just something a lot of my clients will be on. It helps with the production in eggs and sperm. And then it has particularly been shown in research to help egg quality, especially for women over 35. And right, a lot of women get that label of geriatric pregnancy and whatever, like when they're beyond that time, that age. And then you think about just some potential add-ons like iron that supports red blood cell production, oxygen delivery to the baby. Beef liver capsules are a super hot like thing in the functional space right now. It's like nature's multivitamin essentially. Getting a good probiotic on board, or making sure that you're eating probiotic foods. Because that supports not only your gut health, digestion, and it reduces the risk of gestational diabetes and group B strep colonization, because they test you for that in the hospital, is group B strep, and you get antibiotics if you have that, because essentially this is really, really important for people to hear. Whatever you have going on, like in your microbiome, you can pass that along to your baby. I've seen it time and time again, because I started helping moms and female clients, and then all of a sudden they're like, okay, I'm feeling better. Well, my daughter or my 2-year-old or my 6-month-old or whatever is starting to exhibit eczema, psoriasis, all these, acid reflux, some of the other things. And I was like, oh, these are things that you are experiencing though, right? And so that's why it is important to address these things too, like pre-pregnancy. And it's not to like blame you, shame you, anything like that, but just have you realize that the microbiome health is also super important, because you can transfer any of what you have going on, like toxicity wise, to your baby as well. We talked about electrolytes, minerals. I get into depth with like herbal support for people, like ginger, B6 levels, like peppermint to help with nausea, all these like nice little herbal things you can do like during pregnancy too. And collagen really helps with skin elasticity and helps prevent stretch marks and things like that. So there's lots of things, but overall, the ones that I mentioned, like you can find a nice, good prenatal for that. And like I definitely have a example list for people, and I'll kind of share that with you in the show notes.
Yeah, and I was going to say, if your fingers are sore from taking notes, we will have this in the show notes, so you can come back and reference it. I'm as you were talking and you were going through your list, I was thinking, wow, if you are listening to this, it is easy to get overwhelmed just from the supplementation space and then the movement space and all the things that you're doing. And that's why it makes it so important to have that care team working together. Because as I look at it, we said, okay, well, gentle movement. And then if you read on supporting insulin and growth hormone, and the first thing they tell you to do is strength train. So you might go out and you might strengthen. It's if you almost have to think about exercise as a tool for regulation and not exertion, especially during this time. Lindsay hit on it, Kim hit on it, as far as like, this is a time to slow down and step back. So yes, while some strength training is good, this is where working with a coach comes in so that they can balance the movement with the functional medicine information. So, all right, one last question for both of you. If you could give one piece of advice for someone who's maybe feeling overwhelmed, feeling like their body might be working against them, or just flat out unsure where to start, what would you say to them?
I think for me, physically wise, like you had mentioned, I think, it's time to, if you're wanting to get pregnant, start slowing down, taking a moment, maybe tailing back some of the high intensity workouts that you're doing, and just get ready to prepare for something pretty magical.
Yes. Oh my gosh, I love that. Pretty magical. I would say just making sure you get the full picture, and please just don't feel defeated if you've gone into the doctor's office and they're saying some of these things to you that we talked about in this episode. Like I truly believe that your body was meant to do this, and let's peel back these layers a little bit and help you address some things that really weren't being looked at before for you. And there's lots of different tools that we can use to support your body that don't have a drastic, large, I would say, negative downstream effect of side effects and all these type of things, because your body was meant to do this, and we're just going to help support that process.
Yeah. Such beautiful insights from both of you. I think this is a conversation that needs to happen more often. It's okay to slow down. It's okay to pause. It's okay to tune in, and that will give you the ability to take action from a place of care, self-care, and not fear. And that is important. Thank you both for being here today. Thank you for everyone, to everyone listening. Don't forget, if you haven't already subscribed, please do so on Apple Podcasts, Spotify, wherever you get your podcasts. Leave us a review. Also, if you have questions on topics, you can email the
it's info at theintegrativeedge.com.
All right. Until next time.